Good morning, everyone, and welcome. My name is Trin Nguyen. I'm the Director of the Mayor's Office of Workforce Development. Thank you for taking the time from your busy schedule to attend our panel today, which is called the Importance of Childcare, Workforce Development, and Equitable Recovery and Inclusion. This is one of many conversations to prioritize. So this is a beginning to talk about childcare and the intersection of workforce development. So we'd love to hear your thoughts, and we're not an expert in this field, so please bear with us. Thank you to our staff for coordinating this event and our collaborators, the Harvard Kennedy School and the Northeastern University Dukakis Center for Urban and Regional Policy. A few logistics for today's panel. This panel discussion is being recorded for those who would like to access it thereafter, and it will be uploaded to our OWD website, www.owd.boston.gov. Questions and comments can be entered into the chat box on the right hand of your screen during our Q&A, and as I mentioned, we'd love to hear your comments and your questions. Today we have a great panel who know the field and know the industry and have lived experiences, research, and they are mothers and practitioners themselves. So we have a host of great deep experience in childcare. We have Dr. Alicia Sasser-Monastino, Associate Professor, School of Public Policy and Urban Affairs at the Department of Economics, Northeastern University. Alicia will kick off our panel discussion, and she'll present on the topic of how childcare has impacted women in the workforce and an equitable recovery in the labor market as strategies and policy implications for us. Alicia will include data from the labor market, the she recession, employer surveys, responses to the trend, and recommendations for policy employers and practitioners as we move closer to reopening. After Alicia presents, we'll have a panel to respond and answer your questions as well. We have here Alex Valdez, Executive Director of the Mayor's Women for Advancement, MJ Ryan, Senior Director, Human Resources, Mass General Brigham, Inc., Vivian Leonard, Director, Human Resources, City of Boston, who manages over 18,000 city employees across the city, and Yvette Rodriguez, Vice President, Head Start and Children's Services for Action for Boston Community Development. Alicia, I'll turn it over to you to start your presentation.
Wonderful, thanks so much. And thanks for having me this morning. This is a topic near and dear to my heart, being a mother of 4. I'm going to share my screen now with some slides. Okay, there we go. So thanks again for having me. The first thing that I want to get across is that childcare is a critical piece of our economic infrastructure that enables parents to get to work, just like roads and bridges do for commuters. And the obstacles that childcare imposes on workers during COVID-19 are widespread, and they're not limited to just a few key industries or certain geographic areas. There are a lot of families who were able to find maybe some short-term solutions during the initial round of daycare and school closures, although it wasn't easy, as you can see by all of these headlines that I've collected here, that the parents are not all right, they feel like they have 5 jobs, etc. And while most of the initial attention was focused on families with very young children under the age of 5, more of these families actually had some kind of backup childcare arrangement compared to those with elementary school age children for whom school provides an important source of childcare for much of the workday. However, these stopgap measures, whatever people did last spring or over the summer, were based on the assumption that fall would bring a return to school and organized childcare, and that did not happen. And so these are really just unsustainable for the long term. So the longer that this childcare crisis continues, it's likely that more parents, primarily women, will need to drop out of the labor force to care for children. And really put simply, an economic recovery just really can't happen without adequate childcare. Child supervision and care is an important concern for a significant share of the US workforce. About 1/3 of the workforce, or an estimated 50 million workers, has a child under the age of 14 in their household. Of these workers, 30% have a child under the age of 6 who would require even more supervision. And before the pandemic, almost 60% of kids under the age of 5 were in some kind of regular organized childcare arrangement on a weekly basis. So either paid or unpaid. A lot of this was childcare facilities, followed by childcare provided by a relative, like a grandparent, aunt, uncle, siblings. But also school was an important source of childcare for children ages 5 to 14. And even among those, about 10% of school-age children participate in some kind of after-school type of arrangement. The obstacles, again, that childcare poses are not limited to just certain places, but it's certainly the case that this varies across geography. So working parents in Massachusetts rely quite heavily on having the availability of childcare. This map shows you the percentage of children under the age of 5 in some kind of non-parental care arrangement for at least 10 hours a week. And that ranges from a low of about 33% in Nevada to a high of 70% in Massachusetts. The only place that beats us out is DC, and that's not a state. So I'm gonna say that we are at the top of this list here. And also the childcare industry is an important part of the regional economy in Massachusetts, employing thousands of workers, producing thousands of revenues, and yet pay in the industry remains really low, with the average employee only earning about $23,000 per year. And then in addition, you might be thinking a lot about these very large childcare centers. Most of childcare is provided by family daycare providers, and those are sole proprietors who produce about $15,000 a year in revenue, and net about an estimated $9,000 in earnings after their expenses. Of course, as with many other aspects of social and economic inequality, COVID-19 has just exacerbated pre-existing inequalities that we saw, taking a greater toll on certain communities. Even before the pandemic, Hispanic and Native American families tended to live in what we call childcare deserts, meaning they had very few options for any kind of organized childcare in their neighborhood. And you might think that this doesn't affect Boston because we're so urban, but in Boston, according to Child Aware, nearly 1 in 3 children under the age of 6 in working families do not have access to licensed childcare nearby. Childcare provides a service. Like I said, it's infrastructure. It's essential for working parents. It expands the economy's labor force, particularly among women with young children. And it's no coincidence that the expansion of organized childcare happened at the same time that we saw an increase in labor force participation among women. Yet the US stands out compared to other developed countries where the labor force participation rates of women have continued to increase. And researchers have linked the leveling off in labor force participation among US women to the high cost of childcare. And states like Massachusetts have both high rates of female labor force participation as well as high rates of childcare usage, making it all the more critical for us to make sure we expand childcare as the economy continues to reopen during and after the pandemic. And it's not surprising, I think, to most economists that as of the latest jobs report, women are making up over half of the unemployed and account for 80% of all the individuals who have dropped out of the labor market, leading many to speculate about the role of childcare playing in these very constrained choices. A lot of people like to say women are opting out of the labor force. I don't think anyone's opting for this. I think women are being pushed out of the labor force. There simply are no good choices right now. And we saw this even before the pandemic. So a survey that was done in 2018 by the Center for American Progress found essentially that mothers were 40% more likely than fathers to report that childcare had negatively impacted their careers, whereas there was no impact on fathers' employment. So here I'm showing you this bar chart where on the left-hand side, it shows you what happens when to people's employment when the family finds childcare. On the right-hand side, those lighter blue bars shows you what happens when they don't. And you can see the impact on fathers' employment is virtually zero. The impact on women's employment is substantial. And so really most of this is falling on the shoulders of women. Now, the disruption that was caused by the pandemic has raised lots of different issues for all different stakeholders. There's the childcare industry, right? So we've seen that closures, plummeting enrollments, the industry suffered an enormous loss of revenue. A survey that was done by the National Association for the Education of Young Children found 40% of programs would have to close if they didn't receive some kind of support, and that would lead to as many as losing 450,000 slots nationwide. And that's not like that's going to spin up very quickly as we reopen. So that's a huge issue. Second is the childcare workers. I just told you not only are the wages very low in that industry, but between March and April, when we saw lots of shutdowns, over 350,000 childcare workers lost their jobs, and we've only got a third of those back. Parents, right? Working parents who reported needing care. Childcare was not very plentiful before the pandemic. It's become even more scarce during the pandemic. So 2/3 of parents had difficulty finding childcare during the pandemic, including 33% who found it very difficult. And that's nearly double what it had been before the pandemic. And then finally, children, right? Everyone's concerned about the effect on children. A recent survey done in Massachusetts found 84% of parents were worried that their child's missing out on important developmental opportunities like socialization and learning. And now, the concerns have really turned towards mental health even, right? So it's not just, academic or social development, but really concern for the well-being of children at this point. So the research that I've done, we conducted a national panel survey of 2,500 parents. Ironically, between Mother's Day and Father's Day, we really didn't plan it. That was like the best that we could do to get this out the door when the pandemic first started. And we really wanted to see how the pandemic was affecting working parents and what policies and practices could help them. We focused on things like the division of household labor that happened, changes in employment status and hours, health and well-being, whether or not people had access to public policies or certain employer practices, and then how this varied by race, income, and level of education. What did we find? Probably not too surprising to a lot of people on this call. Women significantly increased the time that they spent on schooling children, as well as cooking and cleaning. This chart is showing you, the blue bars are showing you what's happening for men. The orange bars are showing you what's happening for women. The crosshatched things are before the pandemic. The solid part of the bar is after the pandemic. So you see those big solid orange parts are where women are expanding their hours in terms of what they're doing with schoolwork and playing with children, etc. A lot of people talked about the she session. You might wonder what this is. The reason why we're talking about this is for two reasons. The first is that women are more likely to be in occupations and industries that have been hard hit by the pandemic. So think about all the in-person jobs in the service industry, the education sector, even in healthcare. Second was the shutdown and the reduced capacity of childcare, a lot of which fell on women's shoulders. But it's hard to untangle the two of those things. So here, we're just looking at what was the incidence of job loss among women. So lots of women were laid off or furloughed. A lot of that's because they were in those in-person types of jobs. And in addition, we saw about 20% of both men and women reducing their hours as well. Now, trying to disentangle how much was due to childcare versus just losing a job in general, we actually asked people, why did you lose your job or reduce your hours? And nearly 20%, or 1 in 5 working parents, said that they lost a job or they reduced their hours solely because of childcare, which is just crazy to me. That's a fixable problem that we're letting happen every day, day in and day out. And among those who were unemployed, 26% of women said it was solely due to childcare versus 14% of men. So we're losing a quarter of those women who became unemployed just because they don't have childcare. Among those who reduced their hours, it was pretty equal among men and women. If you're able to keep your job, both are sharing in the duties of the household to help with. Now you might say, well, how much are they losing in terms of hours? It's pretty big. It's 11 hours a week on average is what working parents are losing due to childcare. That's more than a day a week, a working day a week. And also it's similar in magnitude to all the other reasons why people are reducing their hours. So it's similar in magnitude to staff reductions, loss of work, or no remote work being available. And a lot of this it's larger for women. A lot of this is because women are more likely to be working in those in-person jobs, right? So they can't work from home and do what I'm doing while my kids have a snow day in the other room, right? I'm sure a lot of people on this call are doing the same thing. We also asked people, when you have to figure out who's taking care of the kids during the pandemic, what are the things that you take into consideration for your decision making? Not too surprisingly, about 40% or so are saying, it's whoever got employed. If you lost your job, you're going to get tagged with the childcare. Who works more hours is important in that decision. Who has a more flexible schedule is more important in that decision. What was shocking to me is that about 30% are saying which person's better taking care of the kids comes into the play. And also that's a larger percentage than people who said they're basing it on which person earns more income. So that might be something that's a topic of discussion during the panel. Both moms and dads, probably not too surprisingly, are experiencing high levels of distress. I think everyone feels that. So 2/3 of both moms and dads are experiencing what we call high psychological distress right now. Women in general are worrying more about job loss, and that's possibly due to a greater sense of uncertainty about when things are going to return to normal, and also about how they're trying to square the circle of childcare with work. They also are not sleeping very well. Men, though, are not escaping this unscathed. And so when we look at measures of parental stress, they're much more elevated in men than in women. And in the interviews that we did, we're finding this is because dads are learning how to develop the mom brain. You know, you're on a Zoom right now, you go make lunch for the kids, you get back on a Zoom, you take someone outside for a sled ride, and you're back and forth. And then men's heads are spinning, having to sort of juggle this for the first time ever, whereas women have been doing this for quite a while. One of the things that I thought was really surprising was that when we looked at who had backup childcare during the pandemic, it was only about 30% of parents, but this really varied a lot across high versus low income households. So high income households, and here we're not even talking very high, we're just talking you're making more than $75,000 a year, we're more likely to be relying on a nanny or a former daycare provider, or even friends. Whereas for low income households, the great equalizer was the grandparents. That was the only source of backup daycare that they were more likely to be using compared to high income households. Now you might say, well, what about, you know, paid leave, and what about all the employer practices we've been hearing about? You know, 24% of parents in our survey had access to paid leave and 4% had used it. And that's pretty much what we've seen historically in terms of the usage of paid leave. Lots of people worry about taking paid leave in terms of the long-term security of their job when those decisions get made. And it's really just shocking to me that we haven't seen more paid leave being used during the pandemic. I mean, when can you use paid leave if it's not now? In terms of the most common COVID-19 practices among employers, it was pretty much to provide backup childcare subsidies, which are helpful, but we are way beyond backup in terms of childcare now. It's just childcare that we need to be subsidized. And finally, in terms of the statistics here, women were less likely to cite childcare as a reason for becoming unemployed if they had access to paid family leave through their employer. So if their employer had walked the walk with this, that helped women stay in the labor market. The other thing that helped them were coworker support, as well as being allowed to work from home, were tremendously helpful for women to hold on to their jobs. In terms of reducing hours, it was more having access to that backup childcare subsidy, having some kind of support from their manager, as well as having the childcare subsidy for that. Again, you know, I can't say this enough that these policies and practices don't get distributed equally. So Black and Hispanic families are less likely to have access to things like paid sick time, medical leave, or have COVID-19 policies such as backup childcare or working from home. Now, what can employers do here? So lots of employers have jumped into the fray because there hasn't really been very much support from the federal government. Flexibility is the most common thing we hear about. 86% of HR professionals reported that their firm is providing some kind of workplace flexibility. Less than 10% of employers are offering subsidies to pay for childcare, although at this point, it might really not be money that parents need so much as time to be able to work, because they want to be able to continue holding on to their jobs, and they don't want to have to reduce their schedules as much. Interestingly, companies are really becoming a little more innovative in doing things. So you see that picture on the right-hand side there. That is a company that actually flipped the office. And so they're a small company. They realized that they could socially distance kids in the office during remote learning and provide supervision. So parents drop their kids off at the office, and then they go home and work uninterrupted. So they've kind of flipped the office, if you will. You also hear about companies like Toyota that have set up virtual learning centers near their plants to be able to provide remote learning supervision for their workers, which has really cut down on absenteeism for them. You know, it's really unclear where we're going to end up when we kind of go through this entire reentry process. We don't even know when that's going to be. But you know, companies are all over the map in terms of, is remote work here to stay? Is it going to be a hybrid model? You have some saying, I don't see any positives. Not being able to get together in person, particularly internationally, is a pure negative. To others who are saying, look, my employees know how to work from home and this is really efficient. We don't need this real estate, to people who are thinking we're going to be in a hybrid situation. And so we better figure out what the childcare situation is going to look like, because this is going to be really something that needs to be figured out going forward. And the last thing I would say is that really the public policy efforts we've seen around childcare, I would characterize as putting a Band-Aid on a gunshot wound. Congress expanded unemployment insurance, and they provide some temporary paid leave program to cover parents. But people didn't even know that there was access to paid leave, which expired in December. They had to access it through their employers. Employers weren't really promoting this as a tool for their employees for the most part. We are seeing that, hopefully the Biden administration in their new package is going to expand that through September. They're going to expand also who it covers. It didn't cover employees of very small or very large employers. We also saw that, there are barriers to the Paycheck Protection Program that really made it hard for the childcare industry to access it. So only 53% of childcare centers and 25% of family childcare providers were able to apply for a PPP loan. And of those, only half even got any money. And they really didn't get very much money. And then finally, the CARES Act back in March provided $3.5 billion for the Child Care Development Block Grant, which sounds great. It was emergency support, but it really wasn't enough even to keep most of the childcare industry afloat. And in Massachusetts, those funds covered like maybe $2,200 a month to eligible childcare centers in July and August. So what can we do now? The childcare industry is just an essential part of the US economic recovery. Infrastructure, infrastructure, infrastructure. I just can't say it enough. And we really just need a large scale and immediate bailout. We saw a $10 billion down payment with the package that passed back in December. The Biden administration is proposing another $40 billion, which would get us to that $50 billion that CLASP has projected that we need for childcare relief. The other thing is we really need to make sure that those family daycare providers who are sole providers can access that PPP program. Among the daycares that have reopened, we really should be learning about the transmission of COVID-19 among children and which public health measures are the most effective in limiting the spread of virus, and how can we think about that for schools. So CDC just came out with recommendations. It's hard for a lot of schools to put these in place. They clearly need all the funding they can get from the Biden administration to be able to do this, to be able to socially distance kids, to have good ventilation, to have enough PPE. But this is really critical. And in addition, we should think about states moving teachers and daycare providers to the head of the vaccine line as essential workers, and using schools as vaccination sites to distribute the vaccine to them efficiently. Employers need to be part of the solution here, right? Provide working parents with flexibility, job stability, supports that they need to weather the pandemic, whether this is expanding childcare subsidies, maintaining or even expanding on-site daycares, providing access to paid leave, even temporarily can help employees who need it the most and retain top talent for the long term. I keep trying to tell employers this is not going to last forever, and not every working parent wants these kinds of supports, but for those who need it, it's essential. And then finally, Congress needs to extend the supports that were put in place by the CARES Act and the Families First Coronavirus Recovery Act to ensure they can be accessed by working parents, right? So this means extending UI benefits that cover people who are caring for children and have lost their jobs because of that, and expanding that paid leave. So I guess to sum up, the research really shows that childcare is not a family issue, it's a business issue. The coronavirus pandemic, exposed this previously invisible link between childcare and the economy, and it's causing employers to confront the cost of what working parents have been doing all along in this invisible second shift. Even before the pandemic, inadequate childcare was costing working parents $37 billion a year in lost income, and employers $13 billion a year in lost productivity. So we've known that this has been a drag on the economy for a long time, and it's just become not just a crisis, but an emergency, like pull the fire alarm emergency here. And based on our data, Barron's estimated that closing schools for COVID-19 could cost about $700 billion in lost revenue and productivity, or 3.5% of GDP. And yet this problem is actually very solvable in terms of standing up adequate childcare for working parents who need it. And with the lack of federal aid, employers are really having to come up with their own solutions, like offering greater flexibility, scheduling remote work, increasing childcare subsidies, and even providing space and supervision for children learning remotely. So I look forward to hearing from our panelists, who I'm sure are going to give us lots of examples of the kinds of things that they've been doing, and hear from more of you as you put your questions and comments in the chat. Thank you.
Thank you, Alicia. You've given us a lot to think about. You've given us a lot to worry about. And so I think that this is, I really appreciate that this is, you know, a call to action. And so, and it's not just going back and revert to old practices, and that when we're coming back, we need to come back better. We need to ensure that childcare as an industry is not just siloed, but it has to include parents, teachers, the child itself, employers, employees, and a whole host of factors to ensure an equitable access to the recovery process. And so no other, I'm sure there's lots of experts, but I have to brag about our panel that we have here, because each of the panelists that will be presenting their experiences and their best practices, as well as challenges, have unique experiences in those factors that Alicia presented and what I stated. And so, Alex, as the new named Executive Director of the Mayor's Office of Women's Advancement by Mayor Walsh, what's your vision in prioritizing childcare and women in the workforce? And I know that predecessors and colleagues of ours have been working over the years to ensure that some of these systemic barriers to childcare is addressed. So love to have you weigh in on that and talk about some of the innovation, particularly around the childcare entrepreneurial fund that was started.
Well, thank you so much, Tran, and thank you for putting this together, and good morning to everyone who's in the panel. It's a pleasure to be here. Like Tran mentioned, my name is Alexandra Valdez, and I'm the new Executive Director for the Office of Women's Advancement. Just a little bit of background, I would love to go and dive more into our current Childcare Entrepreneur Fund. Our Childcare Entrepreneur Fund was originally launched in October of 2019. To give some background information, how we came about the Childcare Entrepreneur Fund in early 2017 and 2018, Women's Advancement, in partnership with the City of Boston's Economic Mobility Lab, went out and did research as to find out why we were seeing such a decline on childcare providers in the City of Boston. And by doing this, we did in-person conversations, specifically focusing on childcare providers within the neighborhoods that we see the most need. And a lot of the feedback that we received from these providers were the lack of training and the lack of capacity that they felt not having the feeling that they were small business owners. So right away, after obtaining a lot of the information that we received and a lot of the feedback, the team, both the Economic Mobility Lab and Women's Advancement, came up and we started brainstorming as to how can we come and help and close this gap, and how can the Office of Women's Advancement and how can the City of Boston be that legway and support. And this is where the City of Boston's Childcare Entrepreneur Fund was launched. About 33% of Boston's businesses are women-owned, generating over $3.3 billion in annual revenue. And over 95% of childcare businesses in the City of Boston are owned by women. As of right now, we have awarded over 70 plus childcare family providers across Boston, and they have been awarded a total of $225,500 to the Childcare Entrepreneur Fund. I always like to highlight the specific numbers. Obviously, during COVID, we have increased the number of applicants. Specifically, our last cohort, we have received 154 new applications. This is applications that have come in different from the previous one that we received in the past. So this means that both our engagement and our outreach and policy efforts have been engaging our residents and our specific childcare providers' families in a way that we are able to reach new providers every time we do a different cohort. And specifically, it represents a third of all family childcare businesses in the City of Boston. I want to next slide, please. Another great point is that we have reached over 100 family childcare providers by mid-year that we have been able, hopefully, to serve. Another great program that we are focusing on to help close this barrier is we are currently, the Office of Women's Advancement has a partnership with Community Labor United where we are helping close that gap for non-standard hours. And those non-standard hours focuses not on your average 9 to 5, but basically employers and people who are going in before that time. So we have partnered with Community Labor United to be able to launch that program where we have focused in partnering with childcare throughout the city or childcare in specific area where they're willing to open as early as 5 in the morning to be able to help us reach that population. And we are looking forward to seeing the findings and seeing how this pilot goes in order for us to continue researching and continue doing more work and funding this specific pilots throughout the Boston, because non-standard hours is a huge population for us and it's a huge need as well. A couple of our legislative agendas that we have supported throughout the Office of Women's Advancement, and which to whom some have passed, is a universal affordable high quality childcare, Fair Work Act, an act to promote and pay transparency in the pipeline and in advancement. And those are just a few of how you can see. And one of the great things about the Office of Women's Advancement, and I wouldn't like say to brag or to speak so great about it, is that everything is done in partnership. And everything is done in collaborating with other City of Boston agencies and also outside agencies who are also leaders in this work field. And this is something that is very important. Working together and working together for one common cause, it's what's going to help us achieve even more and to serve our residents in a way that we are hoping to close this gap. Another great opportunity and another great chance at the Office of Women's Advancement is that we partner with American Association of University Women, AAU, where we are offering free salary negotiations. And up to date, MOA has trained over 10,000 women offering free salary negotiations. As of right now, even though we are during COVID, this information is available and free to the public, and it is on our website. We are hoping that once we get to some type of sort of normal within our world right now, that we are excited to go back and start training and start doing this. As Alicia mentioned at the beginning of her presentation, and a lot of things that came throughout the SHE session, as to that's the name that we're giving. And specifically, these salary negotiations are going to be very front and open when it comes to the city and both everyone battling as to how do we go back into the workforce. And another great of our collaborations is collaboration with the Women's Workforce Council. And this is about helping and keeping our employers in 100% compact signing. And these are just some examples that the Office of Women's Advancement does. And our policy to work and process focuses on high quality, affordable childcare for all working families. And a couple of our pillars that we focus on are access and affordability, living wages and good work conditions. And I do have to say that one of the great initiatives that we have been working on is that Boston is the first city to collect data on childcare arrangements and preferences in working parents. And this is pre-COVID. Through the childcare census survey in 2020, we commissioned a special research study to understand the childcare needs for parents during COVID. With Dr. Kim Lucas and Wendy Robinson, they consisted of focus groups to understand how families with diverse employment situations cope and plan to move forward with COVID. And we are excited that this childcare survey, where it's going to launch in the next couple of weeks in collaboration with the elections department. And this is something that we are eager to see the results back. This will be our second childcare survey that the City of Boston launches, but specifically since this is focused around COVID, the city is really excited to see the responses that we received from families and from mothers and from providers around this time in childcare and COVID, and see how much that has affected, to Alicia's point, how we have focused our shifts and how specifically women have focused their shifts now that we are during these times. Thank you.
Thank you, Alex, for providing us on the ground experience and TA that the Mayor's Office of Women's Advancement is providing. And I think getting surveys from parents and also childcare providers who are on the ground and using that information so that we can develop responsible policies that work for families is really important. I really appreciate that. I'm sure my colleagues and the attendees agree as well. And that is clearly one area that is needed, which is to provide technical support and understanding for childcare workers and the childcare industry. And that, coupled with the employers, is extremely important. So MJ, can you talk a little bit about employers' perspectives on how you weave those factors in? And I know that it's not just you working with one employer, but you have experience with understanding with several employers, particularly in the healthcare field, which is so needed right now. And you need all the frontline healthcare workers as much as possible. Can you talk a little bit about how employers are addressing childcare and what you're hearing on the ground from employees as well?
Sure. Thanks, Trin. Thanks for everyone for having me here. I am no expert in childcare. I don't have children, but I've been a long-term practitioner in workforce development, and we all know how childcare impacts that. So as quick background, been working for over 20 years in trying to get individuals into employment and then move them up from entry-level roles. And childcare is a huge factor in that, as we all know, and I don't have to explain that too much. I mean, especially during COVID, we had many training programs that were put on hold, some of them just because people couldn't accept the jobs that we were able to offer them because of childcare. It's gotten worse with the kids being home from school because it's not only, that it's a daycare issue, it's schooling them, homeschooling them. So obviously, this is a really important work that you're all doing around this, and I appreciate that. One of the things Mass General Brigham has 6 childcare options in our system. We have 4 traditional childcare centers. We've opened our first one in 1990 over in the Charlestown Navy Yard, associated with Mass General Hospital, and we've continued to grow that. We have 2 backup childcare centers at Mass General and the Brigham, which are heavily used. And I will say that sounds wonderful, but of course we have 78,000 employees, and certainly it's not enough. We also have employee assistance program, which refers people to childcare options. Even though our childcare options are subsidized, it's generally not subsidized enough for most workers to take advantage of it. And we know that, and so that we do have a lot of referrals to local community childcare centers. What we did over COVID was take advantage of the exempt emergency childcare program, which was offered, and we ended up being able to offer free childcare for about like 4 months, and that's when our essential workers mostly took advantage of that. But we also wanted to figure out how to, in the long term, I mean, obviously it showed a light that, there's a problem. Everybody knew there was a problem before, but with COVID, we knew there was a bigger problem for lower wage workers to be able to afford childcare and continue in the workforce. So in the spring, we did a system-wide survey for employees, and the results were that there was definitely a high need for childcare, but that the parents weren't really thrilled about bringing their children to a center. During COVID, they were afraid of the safety issues. Additionally, they felt that, where is it? They really preferred the subsidized backup childcare, which we've always heavily subsidized. Many people did think if they were going to take their children to a childcare center, they appreciated that the hospitals would be using very high safety procedures, and that did work for a while. And so in the spring, when we were using the exempt childcare, we were able to offer for free, and many of our essential workers that normally wouldn't use our internal childcare services, probably due to cost, we're able to use them. So that lasted through July. And then we expected to open our doors to our traditional enrollees, and while continuing to highly subsidize the backup centers. And we found that people didn't come back. We had about, like everyone else, we had about 30–40% usage. And then now we're probably up to about 60%. So we looked at, initially when we were looking at the free childcare and how to expand it, we also added partnerships with Bright Horizons and Care.com. Care.com offering more in-home care, which is what our employees were really looking for. And then Bright Horizons offered us 3 additional centers, so it gave us 9 options. And yet they weren't utilized either. People really wanted in-home care, and the people that were even working remotely wanted assistance with their children while they were trying to work from home. And so we quickly reduced the 3 additional centers and went to steeply subsidized in-home options and babysitting options, basically, and assistance with tutoring and other things at home. So it seems that going forward, based on our survey, most of the employees really want the subsidized backup care. Many are already using in-home care, or relatives, or especially the lower wage employees are using, neighborhood daycare. And I think that's why a lot of the stuff that Alex is talking about is so important, because that's what people want. They want to be local. They generally aren't using our centers. Obviously some are. When we asked if in the survey, did people worry about staying employed due to childcare issues, we had about 1/3 of the people that responded say that they really considered leaving the workforce to take care of their children. I'm sure that was mostly women, if not all. So that totally lines up with Alicia's research. We don't have any hard data on anyone that did leave. MGB had a policy not to release workers from work, so we didn't have any layoffs based on COVID. Obviously, we actually needed more workforce in. We did send 40% of our workforce home, and they remain home. So about 30,000 people out of our 78,000 employees are working remotely. And I will tell you, as someone who's doing that and watching the people on the Zoom calls trying to balance their children and their lives and their work, it's quite something. So I guess the best takeaways for us are learning about flexibility, learning the importance of childcare. We're looking obviously we saw who used our childcare services in the spring when they were free. And our leadership is definitely looking at better ways to support people at all levels of income. As I said, it's already we already have like a sliding scale and a way to subsidize it, but to expand that and figure out what we can do going forward, because this really shone the light on how significant this issue is. And so we're definitely looking at ways to improve what we already do. But we do have very deep subsidies, and that seems to be what people are looking for in our workforce. When we're balancing, so someone, one could say we need workers so much. Why wouldn't we just offer free childcare all the time? And the reality is, and I did pose that to our senior VPs before this conversation. And the reality is, that may cost, maybe $50,000 or so a year for individuals. When you're looking at a 78,000 person workforce and you are a nonprofit with reasonably low margins, what do you take away to do that? And so when you look at equity and you look across the system and you look at retirement contributions and you look at healthcare insurance contributions, steep contributions on our part, what goes to provide childcare and how does that become equal? And even if you made it a cafeteria plan where someone could select childcare, do they do that at the sacrifice of their own healthcare and their future well-being? So it's not as easy as it sounds, and especially when we do have, as I said, we have childcare centers, but there's certain capacity. But the reality is, we have to look at it as a total benefit package and trying to balance the employees' needs across the board. This is a significant one. It's a business imperative. It's not something that we take lightly at all, and definitely something that MGB would be looking for now. They're looking at it now and into the future. We're definitely subsidizing we always subsidize, but we're deeply subsidizing for the foreseeable future, and we'll continue to look at how best to support employees.
Thank you, MJ. It's all, I'm so privileged to hear your perspective and what you bring to the table. You should be a senior VP or a CEO. I say that because we have a lot, workforce development can only be successful when you have employers who understand the multitude layers of employees, and for also, more importantly, for employers to roll up their sleeves and weave those pieces together to make it work so that women in the workforce can thrive. And so, we really appreciate the healthcare sector and your leadership in this field. And I'm going to advocate for you to be a CEO. What the hell? Girl.
I see you got the check that I mailed last week.
Sorry, girl. You need to be up there like yesterday. So, whatever we can do to promote employers' best practices, that's what it really takes is, that balance for employees and employers as well. So really appreciate your expertise and your work on the ground. Which brings me to our next panelist, Vivian Leonard, who's been in the HR human resources field for a very long time. I would say over 40 years or more. And Vivian, can you talk about your understanding of various factors to weave so that we can make childcare accessible and equitable? Because at the end of the day, we want an inclusive workforce. And that means reducing barriers equally for segments of the workforce, not just for the few. And so can you talk a little bit about your work with the city? I know that you have direct management of over 18,000 employees from different frontline healthcare workers, from EMTs to police officers, firefighters, service delivery folks, and how you're working to address childcare issues to get them back into the labor force or continue to stay in the labor force, and what are the challenges you're hearing from employees as well? You're on mute. You're still on mute. Okay, we have a little bit of a technical difficulty, and we're gonna work with Vivian.
Actually, I think Vivian is unmuted now. Yeah, you're good. Vivian, do you want to try? Oh, really?
So we're gonna wait until we resolve the technical difficulty with Vivian, and we're gonna pull her in as soon as possible. But I want to move over to Yvette Rodriguez, who's has been working on the ground with childcare providers and who have been advocating with ABCD to ensure the equitable access to quality childcare. Yvette, do you want to talk a little bit about lessons, best practices, and what the city, the state, and the federal government should be thinking about when we're improving childcare access to families and working moms? You're on mute, Yvette. You're still on mute. So while we're waiting for Yvette and Vivian, it might be technical issues on our end. It's very unfortunate because they both have prepared remarks for this work. And so we're going to work on resolving that quickly. But there is a question on the chat. Are we hearing someone who with their mic on? Yvette, is that you? Yeah. So while we're working on those technical issues, Alicia, there is a question for you in terms of that's in the chat, and so one of the questions is for you. Have Congresswoman Clark's staff called on you to provide data and testimony to support federal child care legislative efforts? Clearly, this is something that legislatures or advocates want in the front line, and to have your voice and other researchers' voice and data to back this is really important. are you thinking about efforts to move your research agenda towards legislative action?
Yeah, we've done several things to do that. So specifically in reference to the question, I believe Catherine Clark approached my co-author, Jamie Ladge, who's in the business school at Northeastern. So I should also mention this is not me by myself doing this work, because that would be impossible during a pandemic while raising kids. And so we've given her our talking points. Would love to meet with her staff more if they need more support. Would love to give a presentation. I've also spoken at a legislative briefing that was set up by the Aspen Institute this September to staffers on the Hill to raise this issue and put some dollars around the magnitude of the problem. And then I also wrote a paper for FEMA, so the Federal Emergency Management Agency, which people might say, well, what the heck does FEMA have to do with this? FEMA, when President Trump declared state of emergency in all 50 states, that automatically releases money through FEMA to all of the states. But this was not a hurricane. So FEMA was like, what do we do with this money to help? And so Northeastern University, in partnership with MIT, wrote a series of white papers on the different needs in different industries and sectors of the economy. I wrote about childcare and made the argument that childcare is critical infrastructure. And so childcare and K through 12 systems were the one industry that were left off of FEMA's list of critical pieces of infrastructure like roads, bridges, electricity. Well, now it's on their list. So we did get some traction there. But I am happy to support any other legislative efforts to move this ball forward, because it's essential. And I think economists and working parents are just on fire to be able to get some kind of support to the childcare industry, the schools, dollars into parents' pockets to be able to solve this problem.
Great, thank you. Lydia, you need to unmute Yvette and Vivian so they can have access to their mics.
Yeah, so Vivian should be able to speak. I see that her microphone is green. I don't think I can unmute Yvette. She would need to just click the microphone. Let's see, I can't hear you, Vivian.
If you wait for 1 second, probably 30 seconds for us to shoot the technical difficulties on our end. Believe me, we have been prepared for this. We've got on pre-trials and trials of trials, and to ensure that.
I'm gonna try to make them presenters. Maybe that will help the audio. I'm starting with Vivian. Vivian, you should have gotten a notification that says make you presenter. No.
So in the meantime, Alexandra, I was really amazed to see the city stand up that help to family daycare providers, because one of the challenges, or maybe realizations in doing this work, has been that everyone thinks about large childcare centers when they think about childcare, right? But like 2/3, or actually 3/4, I think, of kids are in these family daycares. And so being able to support them, and they have the least access to the Paycheck Protection Program. They're also, living sort of hand to mouth in terms of revenues, but being able to support those family daycare providers throughout this pandemic. The other thing is they're providing care in exactly the kinds of situations MJ's workers want, right? So they're providing care that's, small group, potted up, limited, nearby to where they live for the most part. And I know one of the things Trin and I have talked about is, the other thing that needs to happen is just the professionalization of care, right? So most daycare providers, the wages are extremely low. it's not like we can get lots of efficiency by automating this process, right? It's a declared ratio of how many people, right, to kids that we need. And so it's really a matter of being able to support that infrastructure with livable wages, as well as, you know, development opportunities, and expanding really this network of family daycare providers during the pandemic that's providing the exact kind of care that parents really seem to want, from what we've heard of.
Yeah, you are 100% on the point. I mean, when we focus and when we have these conversations with providers during our cohorts, a lot of the conversations around is what technical assistance do you think it's needed in order for you to feel like your time is being used the most? And I have to say, out of all of the technical classes that we have given, one of the ones that are one of the best attended and more engaging, and this is so thankful for Melinda Weber from United Way that she's leading these courses, is our budget classes, and our classes to focus in how do we create a budget in order for these providers to sustainably run their daycares. Just thinking about the cost, comparing the cost, and that's a whole nother conversation that we will spend here hours talking about the difference between private pay and voucher pay. It plays a huge difference, especially in the middle over the pandemic. A lot of when the childcare providers were asked to shut down or were even asked to reduce capacity, that brought a lot of burden and a lot of financial stir for the specific providers. A lot of the money that was used, that was received for help, was going into PPE, was going into creating their spaces in order for them to be able to physically distance the children who they were caring for. And we're talking about providers who only have space for 6, 7, or even 10 children. So if we're talking about reducing capacity to more than half, a provider who's looking at an income that will come in from 10 different children now compared to 5 different children, that's a huge financial burden on them in their everyday lives. And we're talking about small businesses who are 95% women, like I stated before, and a great percentage of them are minority owned. And that just shows, and that's a point where, to your point, Alicia, finding and getting those efforts into assuring that we're giving them also that quality opportunity of being paid correctly, of being paid enough for specifically the job that they're doing, that they are educators. And that's a lot of the feedback that we received at the beginning of when we were getting information before the pilot launch, was that need of feeling that void of not feeling like they were early childhood educators and more looked upon as not being small businesses to cater to our community.
Yeah.
Right.
Do we have
one for Yvette and Vivian yet?
No, I don't know what's going on. Tran, I gave you access to mouse control. Maybe you can also see if you can try to unmute them as well. I'm not sure if that would work.
Yep, I don't have that control, but
Okay.
there is a question that that came through the chat, and I totally agree with it too. I mean, you know, when you were thinking about childcare and looking at it from either an employer or a policy level, clearly there are, within the childcare industry, clearly there are discrepancies between, you know, low wage workers accessing childcare, and then also, you know, this remote control, this remote work environment and learning class accessing childcare. And so, you know, Alicia and MJ, just want to hear your thoughts on, you know, on how to segment some of those specific strategies within childcare so that we can intentionally address and tailor it to different groups of the workers.
I think I'm on mute now.
So if I jump in, I think, again, it goes back to being able to subsidize heavily those that need it the most. And we do that. We segment it between different earning levels. I think that's huge, and it's got to continue and probably go deeper for us. But when you think and going back just to the last points being made, you know, when 50% of childcare workers are on public assistance, they are the low-wage workers. They're the essential workers we are expecting to, you know, go into COVID. They were the same people. They were the people running into the hospital to work that were low-wage workers, in all honesty, or lower. And then there were the essential workers in childcare, caring for people. And there's been government money thrown at training to try to increase the level of knowledge for childcare workers, but they're still losing them at the other end because they're not paying them enough. The lowest paid bachelor's prepared person in the country is a teacher in daycare, in childcare. And, you know, so that's just untenable that they're making, some people have a bachelor's degree are making $15 an hour and as teachers in childcare. So until we fix that, I mean, I met with our director of childcare in preparation for this discussion, and she said it's not just now. For the last couple of years and longer, there's been such shortages of personnel that they can't expand their you know, when we become MGB as a childcare operation in our 6 centers, we don't have enough teachers to expand or even care for, I don't know what happened to me. But we don't have the capacity to expand or even to care for more of our employees' children because we can't get teachers. And that's a national problem. I have friends on the board of the nursery who are the same thing. There's no teachers. They keep continuing to increase the need for bachelor's degrees and for high level training, and yet the pay just isn't working. So, you know, the same reason we can't keep essential workers, childcare can't keep them. And so even though you train more, unless policy gets to the point that they are essential and they pay them as essential workers, which I hope, you know, I'm praying that our new administration who feels that people should work one job and be able to feed their family, we'll see that come to fruition, because, you know, for now, what we can do is continue to subsidize, but in the long run, it's going to be an issue as long as we don't pay child workers, childcare teachers.
Thank you, MJ. Do we have Yvette and Vivian on board? We're hearing some really bad echo background.
I tried to call in, so
Okay, Vivian,
that's what I did. Because
Vivian, we're hearing you. We hear you.
Yeah, so I'm blocked on the microphone front, but I did use my phone to call in.
Great.
I said I just can't let this go by without having some type of participation.
Absolutely.
Trent, you give me too much credit. 40 years, that's way too long.
We're hearing an echo. If you can turn off one of your devices, it'd be great.
Okay, so I'm going to try and maybe log off of here.
That's what I did.
This is the only way. Okay, so can you hear me now?
We hear you perfectly. Go on, girl. I know you got something to say about childcare.
Well, 40 years is definitely too long, Trent. It's been about 25 years that I've been in this profession, and have had the pleasure and honor of serving in this profession as a human resources director, but also more importantly, doing work with Trent that highlights issues such as this. And I do have to say that working for the city allows you to look at these issues from a more global perspective. Yes, we are an employer, but I also have the honor and privilege of working with my colleagues like Alex and Trent to think about these issues more globally and the impact on the city. So first of all, I do have to give credit to Mayor Walsh in terms of even pre-pandemic, thinking about how he could expand pre-K. And so that has been, I think, wonderful for families until we hit COVID. We really were annually starting to expand pre-K as a part of our Boston public school system, which allowed families to have more options outside of childcare. Childcare, the pandemic has definitely shone a light on childcare and women in the workforce. Looking at the Pew study, and it was great to see Alicia's study, but just looking at Pew, brought to light that for every male that lost a job, we had 3 women that also lost jobs from February of 2020 to September of 2020. Mothers of small children lost jobs at 3 times the rate as single fathers. So single fathers lost jobs during the time frame of February until September at the rate of 6%. Compare that to single moms, according to Pew, who lost jobs at the rate of 16%. So I think what was already an existing issue, like many other issues during the pandemic, have been brought to the forefront. I think it's amazing to me that, the study talks about the fact that it only took a few months to set women back over 35 years in terms of the progress that women were making in terms of excelling in the workforce, although childcare did remain an issue. So the Institute for Women's Policy Research, and I agree with them on this, basically says this is setting gender equality back, but we as a society have the opportunity to look at this as just that, an opportunity in terms of the policies that we make, and from not only the federal, state, local level, but the private sector, and how can we partner to ensure that the policies that get implemented improve the lives of working mothers. So just some of the things that the city has done is for working moms is benefits. Benefits are crucial to working moms. Being able to know that you have health insurance to support your family. I'm happy to say that the city of Boston is one of the lower cost health insurance, has one of the lower cost health insurance plans where we as a employer pick up a majority of the cost so that employees can have good health insurance. But that's the result of a partnership, administration of finance cabinet with the unions, that we've been able to maintain reasonable cost health insurance for employees. In addition to health insurance, it's important that we make crucial benefits available to working mothers, such as sick leave, vacation leave. These are all crucial so that mothers feel like they have options available to them to care for their family. You will find that in industries where women are the essential workers, they are going to work sick because they don't have health care available to them, never mind child care. And so they feel like they need to go to work and try and figure out what options, such as Alicia had said, and others, such as using the grandparents, if you will, or family members to be their backup child care. The city has also made paid parental leave available to employees, which is huge, considering that when women have children, if you're not providing a means for them to support their family while they're out trying to take care of their child that they've had or adopted, then we as employers are not doing as much as we can. And of course, it is a cost, but once again, women bring a lot to the workforce just in terms of their ability to make a contribution. And I think the more global thinking is that not only are they making a contribution to the workforce, but they're making a contribution to the economy. So these are things that the city is doing in addition to offering an employee assistance program. Most certainly during the pandemic, the stress factors are real, as Alicia talked about in her study. And therefore, women are feeling more stressed as it pertains to not only childcare issues, but also conducting, like overseeing their children during this virtual learning process. And by the way, if I still have a job, I need to make sure that I'm performing at my job. So we've had to hire an additional 2 employee counselors, licensed counselors, in order to deal with the increased volume of the influx of calls that they are receiving. We've pivoted to doing virtual calls for well-being versus the in-person visits that were happening pre-pandemic. The other thing that we do is we have what's called the Small Necessities Act. So annually, we allow 24 hours for parents to attend such things as parent-teacher conferences, any activities that relate to educational advancement. Also, the 24 hours can be utilized towards routine medical appointments, in addition to elder care. We also offer the option of medical leave if necessary. Employees can utilize if they have vacation, they have sick leave in order to take care of their children or, themselves. They can apply for a medical leave. But I think the approach to this is multi-pronged, as I've heard many of the presenters on the panel state. And I think that's the direction that we have to keep moving. And childcare is essential. Trin and I know this. She and I work together on programs that train women to enhance their skills, to prepare them for jobs that will provide them with better pay and allow them to, be better situated to care for their families. But in order to do this training, they need childcare vouchers. Training Inc. is one of those programs that we work with out of many, but the crucial element to being able to participate in the program is having a childcare voucher available to the mom who is going to take that program. So I just feel like we have an opportunity in the midst of a pandemic to come out better on the other end by approaching this from a multi-pronged policy stance.
Thank you, Vivian. I think that perspective, first, we really appreciate your persistence to keep calling in to make sure that your voice is heard and your experience is known. I think that's extremely crucial. So thank you for that. And I really appreciate, as do my colleagues and the attendees, appreciate what the city is doing for their own workforce. And so it hasn't been, easy as well. I mean, we've had really to push Mayor Walsh, which he was a great leader in working with us in developing policies that make sense for families and workers. And Vivian mentioned some workforce training for city workers is to move them up the ladder. And so, once we had entry-level workers who are women obtaining jobs within the city called City Academy, what we did was link them to child care services and programs that the city was providing them, plus vouchers from the state, available vouchers from the state. And then we came in with incumbent worker training funds so that they can get their actual certificates and industry credentials to move up the ladder to one of our employers, which is our sister agency. So it really, we have to look at a multi-pronged approach to an ecosystem, which really brought this conversation back to what Alicia said earlier, and all of you, which is even, for you, MJ, as an employer from the healthcare sector and from your own experiences, that you really need to juggle all of those experiences and those stakeholders to make the ecosystem work. And I truly think that that is, unlike many industries, the childcare and women in the workforce need that ecosystem to thrive. And so unless we connect, it'd be hard to create a model that works.
And I think
Are you on?
Yes, I'm on.
Okay,
Can you hear me
great.
now?
Yes, Yvette, thank you for your persistence again. And Yvette, can you talk a little bit about your experience and as a practitioner in the childcare industry that you have experience with, and a
Yes.
lesson, best practices?
Yes. Thank you so much for the invitation. And Alicia, thank you so much for your presentation. I love it. I want a copy. But anyway, so I'm going to talk based on my current role. And I have been in this field for the last 23 years and 13 leading the ABCD Head Start and Children's Services. So we serve current in cumulative a year around 2,700 children from birth to 5. And 20% of those are two parents family. And I'm sharing this data because it's important, tied with Alexa and Alicia presentation. And 74% are and single parent, mostly mothers, females. So the early childhood workforce is also predominantly a female world. So knowing this is that a lot of them has a responsibility of go out to work. So ABCD Children's Services providing innovative during this pandemic. So before the pandemic, we were already facing big challenges in terms of the shortage of the early childhood workforce that has been mentioned before. We were not the exception. When we learned that 32% of our current teachers started as parents, to face this shortage, we start creating a pipeline, and we have done some cohort of preparing parents for training and paying for their education, and also giving them the opportunity to work so they could transfer knowledge to practice right there and implement what they are learning. And another challenge is the low wages, and this is pre-COVID, the low wages. And there's a disparity between a teacher that has a bachelor degree in childcare versus a teacher that has a bachelor degree in the school system. The discrepancy in the salary average between 20 and 25,000 a year, that's significantly important. And that brings me a lot of concern, because we always have been saying the importance of childcare. Today, all my colleagues here has validated that. But why we still treat differently the early childhood workforce rather than the school systems teachers? You know, even on the unemployment department, we are in a different category. And don't get me started, because I will take the rest of the day. But anyway, and when the pandemic started, it was challenged to every single human being. I believe we were not the exception, because we needed to start rethinking how we're going to do this new way of doing business. And we were lucky that the federal government Office of Head Start allowed us to continue paying our staff. So none of our staff needed to leave or did not get paid, because we were able to do that. We did shut down on March 13, but we reopened on July. And during that period, we need to figure out all the regulations, all the licensing, the new and most of all, how we're going to continue serving the children, and how we're going to teach our workforce to this new way of doing business. Because at the beginning it was virtually, and that was, I'm learning technology myself. As you could see, I have some problem here. So imagine our teachers. So we want to make sure that our teachers don't feel intimidated, comfortable, and skilled to do the virtual learning, as well as parents. But one thing that is have concern and continue being the concern is about, what about the children? We talk about business, we talk about governance, we talk about workforce, but what about the children? And all the time I have been concerned and raising the voice about how we're gonna address in all this plan of reopening and providing the children needs. The children has been out of a education setting for quite some time, How are we going to continue supporting them mentally and social emotional development that is so important? How are we going to receive them when they come back? So we have to work with the children, the family, and the staff, because the child will come and hug. Oh no, now we cannot do that. So, and I'm trying, and by the numbers. Right now we have been serving between virtual, face-to-face, and hybrid, because we have to develop some plan to really address the reality. And 52% of our preschool children are in the program, 65 of them face-to-face, 35% virtually. We develop, like I mentioned, a face-to-face and a hybrid model. And we have developed training on virtual learning. We provide send home curriculum and lesson plan and education material thanks to federal funding and the CARE Act funding. We purchase educational material, so it goes home. Weekly lesson plans for parents and supporting the parents to do this. And one of the biggest challenge is that not only we started with a deficit in the workforce, but now we have a lot of workforce that cannot come to the work, not because they don't want, just because they themselves have to be taking care of their own children. So how can we ask them to take care of our children at the expense of they not taking care of their own children? Not only they have to take care, but also the school systems are going virtual, so they need to be there to support the children. And that is a challenge, a big challenge. And another big challenge that we are facing now during the pandemic is the people that we have, the teachers that we have to put in quarantine. We are lucky that we haven't had cluster and it has not been developed in our program. But when they are exposed, a teacher, and they could be exposed outside within the family or whatever. So that continues to be a challenge. And another challenge is that everybody talk about the workforce, the vaccine, the testing, but it's K to 12. What about us, the early childhood people? Our people has been working since July. There are no mention still how we're gonna get our workforce, early childhood, vaccinated early on. In my opinion, we are frontline as well, because we're taking care of those children. We are contacting those children. We are not having contact with parents, but we are having contacted with the children. And how come we are not considered frontline and we are not in the conversation of getting the vaccine? I'm not sure all the staff want to get vaccine, but those who want, that should be available, because we are face-to-face since July. And this situation was new to all of us. Early educator program were asked to reopen, as I mentioned, in July. And we cannot ask them to take care of the children, like I mentioned before. And when their children are, I had a call from a teacher that says, I have 3 children, each one in a different school. I want to work. I need to work. I need the salary. But how can I do it? Because I don't know nobody. I don't have nobody to let my children. That breaks my heart. It's not our program like that. I'm sure there's many, many, many across all the child care field. When we are talking about reopening and helping the economy for our city, we all have to be aligned. We cannot be demanding something different. We cannot have double standard. We cannot be demanding something to the early childhood field. I'm sorry, I want to be honest. They told me talk from my experience. So, but other systems that are taking care of the children are abide by different regulations. So if the early childhood field is so important, and I don't like to say child care only because we don't take care, we educate children as early as this age. Early education and care, because we do both, is so important. How come we mention it, but we are not taking action to bring and lift up this field to the same level that we are bringing everybody else? When we are talking about reopening the economy of our city, we all have to be aligned. It's like the Boston Symphony. They all have to play Beethoven. But if the trumpet is using a different music and the other, no Beethoven is going to be listened. We all have to be playing the same music. And business cannot open because staff don't have childcare. Childcare cannot operate effectively because we don't have the workforce. Therefore, this is like a domino effect. So who and how we gonna really address this issue? I think some of the challenge in my experience is that when these decisions are being made, not everybody who has impacted or is impacted by this is sitting at the tables. I think it's time that we bring, not everybody work isolated. We need to bring business, government, so we should not be responding to government pressure or business pressure, but we need to hear the voice of the family, the parents, the, the parents, the workforce. But among all that, I think I would love to invite that we all keep asking this question. What is the purpose of early education? If it's only to reopen the economy, if it's only to fulfill the needs of the government, if it's because it's about the children, what is that young children needs at this time? Because at the end, we all are being affected, but the children are significantly affected. And I don't hear that much talking about the children. No possible solution can be brought if only one of us is taking the lead of one of the people that I mentioned, and maybe more, is missing on those tables. No solution can be responded. As Alicia mentioned in her presentation, I think this is a great opportunity. This has been challenges for all of us. I tend to think that challenges are opportunities for new way of seeing. And I love when she said, we need to come back to better. I would like, as a provider of that many children, the most vulnerable children in the city of Boston, Mystic Valley as well, but majority in Boston, how can we come back for better? How can we put in place what we have learned? How can we finally bring the workforce of early education to the same level as professional in the school systems? They have degrees, they have a lot more regulations to follow. The school systems are exempt of many of the regulation. In the early education field, no, there's a lot of regulation, but granted, they are requested more, they are required more, they are more at risk, but they are paid a lot less. Remember, the difference is between $20,000 to $25,000 a year of discrepancy. So I would like to see, I want to be a big advocate, and I will continue being a big advocate, not only for the children, but also for the workforce. We have a workforce that is caring, is nurturing, which is essential, and is also well educated, so they need to be treated as professional. So I'm going to stop here because I know that we have some glitches, and I hope that I make my point.
Yvette, you made your point, girl, loud and clear. So deeply appreciate that, and deeply appreciate your persistent to keep logging on and telling us just a glimpse of your work. And girl, I'm scared already. And then also to Vivian Leonard, who really talked about her experience with working with various city departments, negotiating collective bargaining, and really advocating for what is just for all workers as well, and the lessons and best practices. And so, Vivian, thank you. I know she was early. MJ, you're always a great advocate. And like I said, I'm still advocating for you to be the CEO. Forget senior VP, girl. So really having an employer that gets it and then knows the business model too is a win-win for the city and our workforce ecosystem. Alex, congratulations on your new role. I think the mayor did a great job with your leadership. We know with your advocacy and your work on the ground, with your research skills and your competency, you'll take the city to a legislative and really push the feds to get to where they need to be with women in the workforce and childcare. Alicia, girl, I read you on the New York Times and the New Yorker. So thank you for your persistent advocacy in this field. You're not just a researcher, you stand side by side with practitioners, policymakers to really ensure that a lot of these great ideas and policies are operationalized through your research. So thank you for your willingness to be open and to learn and not just be a traditional labor economist. Lord knows we got a lot. So, you know, thank you for your work. What I specifically thank Lydia Sarufis, who is the technical assistance to this webinar and to this work. A lot of this we had a lot of planning. Believe me, don't think that we had a couple of glitches meant we were not planning. We planned a plan and plans, and something always goes wrong. But you know what? The folks here said what they had to. So I want to thank our audience with us and our attendees for great questions. We couldn't get to all of them. And just know that this is not the end. This is a beginning. And for us to move forward to making sure that the recovery is equitable, we need an ecosystem together. There's no crabs in a barrel here. No one's going to get above someone else. We need to come out of this better, like all of my colleagues have said. And it would be a shame if we did not practice what we preach and to learn from our mistakes. So we can be better, and we know we can. So let's stick with it. Just a reminder, Alicia Monastino's slides will be available and uploaded for you to access. Our work is to ensure that we have resources and tools for you to do your advocacy work and to include this in your agenda. Also, this will be recorded if folks need it, just to cut out the technical problems that we had. But overall, I'm so privileged to hear people's perspective. Be in tune for OWD, HKS, and Northeastern on work around this topic. We have a lot more coming, so be in tune. And thank you so much to our panelists and to you all who have attended.